What's your name and date of birth?
Megan Woody, 9/15/90.
Okay.
Megan Woody is getting her vitals taken again, but she doesn't mind. It wasn't that long ago when she learned she had leukemia. The diagnosis was hard to believe.
I just kept thinking, I don't feel very good, but I'm worn down. You know, it's temporary, I'll go back to school, it'll be fine. And I think you can rationalize away a lot of different things, but not leukemia, I guess, so.
6 months into her treatment, more bad news. Her friend since childhood was diagnosed with non-hodgkin's lymphoma.
Hearing about Megan, it's not something you ever, really think about happening to somebody that, you're that close to and that your family's been that close with. And then, when I heard that I had it, it's like even more so just like, I don't know, just kind of frozen.
Neighbors growing up, Megan and Spencer were both healthy and athletic. She cheered and ran track and enjoyed outdoor sports. Spencer medaled in tennis and football. Both were pretty smart, too. Megan is pre-med at Boston College, Spencer pre-med at Miami University.
So they're following in my footsteps. The big shoes to fill. It's going to take a long time, but they have potential.
Dr. McGurk is director of the Blood and Marrow Transplant Center at the University of Kansas Hospital.
In all honesty and seriousness, it's difficult to put into words how heartwarming it is and how exciting and how privileged I feel to have taken care of these two young, beautiful, very bright people.
While they share similar medical interests, their cancers were very different.
So Spencer has a large cell lymphoma that did not go into complete remission. And so in that circumstance, he used his own stem cells to support the administration of intensive chemotherapy to kill off the cancer cells, which was successful. Megan, in contrast, had a disease, a leukemia or cancer of her bone marrow stem cells. So we had to get rid of her entire bone marrow and her immune system in the process and replace it with a foreign immune system from an unrelated donor. That's a very different type of transplant. That really is more akin to an organ transplant. It's very complex.
A blood and marrow transplant used to be a last-ditch effort to save a cancer patient's life. Now, it has become part of the frontline battle.
The outcomes are much better, the risks are much less, and the bottom line, long-term, relapse-free survival is much better today than it ever has been historically. And that's because of the modern, state-of-the-art type of therapy that both of these young people have received.
Packed up.
Yeah, so they're gonna drag
Megan is back in school. Spencer hopes to be hitting the books again real soon. Both say they are grateful they came home to the University of Kansas Hospital. For the University of Kansas Hospital, I'm Jill Chadwick.